Hello, so this video is about me and cancer. So I've been asked a lot of questions in the comments, obviously, because it props up in quite a few videos. And I thought, right, I'll do one video to try and explain everything, especially now that the main cancer treatment is over and done with. And so if people ask questions, I can refer them back to this video. So early 2015, I first started having problems and pains. So I went to my GP, which is the family doctor, and they then sent me on to see a colorectal department at the hospital. And then they basically sent me off for a whole load of MRIs and CT scans and blood tests and a biopsy. And the biopsy showed that I had cancer. Now it turns out that this is a form of cancer where your family history is pretty important, and there is a family history of bowel cancer in my family. It's just me and my dad didn't know about it. It turned out that my grandmother had bowel cancer and had basically just disappeared off and had the surgery, stayed with relatives, and then came back when she was fine. And yeah, that was from the days when things like that were kind of pushed up. I don't know why, but my dad never knew about it. We only found out about it when we told people in the family that I had cancer. So if I'd known beforehand, I should probably have had screening, but we didn't know. Anyway, so I find out that I've got bowel cancer, and then there's a whole treatment plan laid out in front of me. Now by this point I'm kind of resigned to the fact that I've got cancer and I've just got to get through the treatment. You know, when they started doing the barrage of tests, I realised that it wasn't for something simple. You know, they weren't acting like, oh, it's just a minor thing. It was really serious. So I was kind of ready to face the fact that I'd got cancer long before they told me that I'd got cancer. Now my personality type, I'm not really an optimist, but I'm not really a pessimist. I'm just one of those people that goes, this is how it is, this is what's got to be done, let's get through it. So I go through the first surgery, which is basically a colostomy surgery, which basically means I now poo into a bag that's attached to my stomach because they don't want things going past the tumour because it's incredibly painful, and they're about to bombard the tumour with radiation and chemotherapy, which is going to make things even more painful. So at this point I have a temporary colostomy, and when I'm sufficiently recovered from that surgery, that's when 6 weeks of radiotherapy start. So that's 5 days a week going into the hospital and having my backside irradiated. And the quote for radiotherapy departments is, it burns on the way in and it burns on the way out. So imagine the worst sunburn you've had on the most sensitive parts of your body, and that's pretty much what radiotherapy is like after 6 weeks. I had the maximum dose of radiotherapy I'm allowed. I don't think I'm allowed any more for 10 years. So they did their best and they completely bombarded and burnt my body. I also had 2 weeks of chemotherapy during this time, where I have a very long line shoved up my elbow that goes all the way around to my heart, and I wear like a pump that constantly pumps this chemotherapy drug into my system. I have that on the first week and the 4th week of the treatments. So it's quite an intense and unpleasant experience. The chemotherapy makes you feel rotten, and the radiotherapy just makes everything uncomfortable and painful. But like I say, no matter how unpleasant it is, you've just got to get through it. A bunch of highly trained medical professionals tell me that this is the best way to get rid of it, so that's what I do. When I recover from the effects of the chemo and radiotherapy, I then go in for another biopsy. So this is to see what the result of the chemo and radiotherapy is. And they take 15 little samples from the tumour and the area around the tumour. And unfortunately, out of those 15 samples, one of them came back to still being active. And if you've got one active cancer cell, then pretty soon you can have a lot of active cancer cells. So the chemo and radiotherapy didn't get rid of the cancer. And this is the big kick in the teeth. This is the point where I was basically fuming mad and depressed and sad and loads of emotions all at the same point, because if the chemo and radiotherapy had worked, then basically the life after the cancer would have been pretty much normal. The colostomy would have been reversed once the healing had been done, and life would have been back the way it was. But because it didn't work, life was never going to be the same again. I had to go in and have major surgery. So the way to get rid of the cancer is to chop out the tumour and chop out everything around it that they can. Now, unfortunately for me, the position of the tumour meant they couldn't reattach things afterwards. So it meant that the colostomy had to be permanent, not temporary, and it meant that basically I just don't have a rectum or an arsehole anymore. So no matter how positively you look at things, life with a colostomy and life with the effects of major surgery just isn't going to be the same as it was before. Now, it doesn't mean it's going to be awful, but it is an awful lot to process because you don't really have time to process it. When they tell you you've got to have this surgery, what they're saying is you've got to have this surgery next week. Cancer is one of those things where there's an awful lot of time waiting after treatments to discover the results, but once they know the results of things, they act immediately. So yeah, I go in and I have this major surgery. Now, when I'm making this video, that was 9 months ago. I had the surgery in May 2016, and I've been slowly recovering since. They've done CT scans and those have shown that the cancer has gone. My official diagnosis is no evidence of disease at the moment. So at the moment I don't have cancer, and the actual surgery seems to be healing quite well. So everything seemed to be going fine, but some of the effects that I was having after the surgery have lingered on. I occasionally get stabbing pains. I get strange aches and pains in areas that weren't affected by the surgery but are in the same general regions. And there's a few other issues I won't go into because you don't really need to know. Basically, there's problems that seem to be caused by the surgery that don't appear to be getting better or going away. Now, the first thought that the surgeons have is nerve damage. Basically, surgeons always think that everything is caused by surgery and everything can be fixed by surgery. But nerve damage was a possibility because where the tumour was near a bundle of nerves. And they did know this and they did tell me this before the surgery. But, you know, at the point where you've got cancer, you need to have it cut out. You know, nerve damage seems like a minor thing. And the effects of the surgery and this possible nerve damage really are quite minor. But they're, you know, the kind of things that just make life a bit uncomfortable and a bit irritating. So now they're investigating to see if this is nerve damage or if this is just something else that's happened to have cropped up at the same time. It could be an infection, it could be just a general problem that isn't related to the surgery, but they've got to test for all those things and rule them out, because there's no real test for nerve damage. They're going to do some more CT scans to see if they did chop out or get really close to this area where the nerve bundle was, but they can't really tell for sure. So they're going to test for everything else, rule out everything else, treat the symptoms that I have at the moment, and basically just see what happens and what appears. The one thing we know it's not is cancer. So we know there's no other tumours that are affecting anything because that is basically what they tested for in the last CT scan. But what they didn't look for was incidental things that might have been in the area, and they didn't check to see basically whether the surgery got close to that nerve bundle. So I'm going to be having more CT scans and more detailed CT scans of that particular area. So that's a history of the treatment and what's physically been done to me. What you can't really tell with cancer is how it affects you mentally and socially and all that kind of stuff. So over the last, well, it's getting on for 2 years now, my life has been pretty insular. You know, I wasn't able to get out. At the start of it, I was in severe pain and on morphine until I started having the surgery. Then I had the surgery, which I had to recover from. Then I had the chemo and radiotherapy, which I had to recover from. Then I had the second surgery, which I had to recover from, and most of this has been at home. You can't get out, you can't do anything comfortably, you can't travel, so you basically just end up at home in bed or on the sofa watching TV. I had friends come round and keep me company, but it's still a very insular problem. If you live on your own, which I do, then yeah, you pretty much got nothing but yourself and your mind to keep you company. I listened to a hell of a lot of audiobooks, watched an awful lot of series on Blu-ray and on Netflix and Amazon. It's essentially just, you've got to get through it and cope with it. Like I say, I'm not really an optimist, so I was never in that sort of, yay, we're going to beat this club, but I also wasn't in the pessimist, oh my god, this thing's going to kill me club. I was just getting through it as best I could. You obviously get periods where, you get days where you just fucked off and don't want to do anything. You don't want to talk to anybody. You don't want to interact with the world at all. You just want to curl up and shut everything off. And sometimes those would last for a week or two. There's nothing you can do about it. This is not a good situation. Having cancer isn't good in any way, shape or form. There are people who say you've got to keep a positive mental attitude and you've got to use support groups and all that kind of stuff. I tried a support group for people with cancer, and you just turn up to the hospital and it was the most depressing thing I'd ever done, because you're in a room with other people who've got cancer, and trying to be happy and bluff your way through it just doesn't seem to make any sense, because everybody in that room is miserable and pissed off because they've got cancer, and I don't see what sharing that is achieving, because I already knew I was miserable and pissed off. So yeah, basically I just got through it. That's the only thing you can really do, or for a personality type like me, that's the only thing you can really do. So cancer effectively put my life on hold for 2 years. So in May it will be 2 years. Now things are better now. I do get out and about, and I can go for a walk, and I can go shopping, and I can go see friends and all that kind of stuff. But it's all a lot more complicated, and it's all a lot more difficult. I still get tired a lot more quickly than I used to. I can't walk as far as I used to without it start becoming painful and achy. So I just have to take care a lot more and plan things a lot more. It's just changes your life. There's no way around it. If you've got cancer, or if you are recovering from cancer, it changes your life. To be honest, I don't expect things to be back to a more normal state until next year. I wouldn't have thought. I think 2015 was the year of discovering I had cancer. 2016 was the year of getting rid of it. 2017 I see as the year of adjusting to what is going to be the new normal. And 2018 is probably going to be the year of being normal, or being this new level of normal, and just getting on with life again. But I can see 2017 is going to be a year of adjustments and changes, and hopefully progress. So trying to get back into the swing of things, trying to get back into my hobbies again and my interests, and just trying to get life back to some normal level. Now it's not going to be the same normal level that it was in 2014 before all this started, but I'm not expecting to go out and run marathons. I couldn't run a marathon before, so why would I want to try and run a marathon now? But I think if I give myself the goal of 2018 for normal, that's it's not a pessimistic view, it's not an optimistic view, it's just what I think is a realistic view of where I should be. It's going to take a while to sort out the new medications and work out what exactly causing the problems I've got now, and then if we give that another few months to get over that, and then to establish a level of normality, then I think I can finally say, right, I am done with cancer. I've got to go back every year for a CT scan, and in between those I've got to have blood tests to check for the cancer markers. But once we've sorted these post-surgery issues, then I can really say, right, fuck cancer, let's get back to life. So that's the story of cancer and me. It's not a happy story. Okay, it's got a happy ending because I'm still here, but it's been 2 years of pretty much drudgery and misery, but it's something you've just got to get through with. If you want to be alive at the end of it, you've got to go through what they tell you to go through. That's what I've done, and I'm still here. So I hope this answers any of the questions you might have had, or any of the thoughts you might have had as to what's been going on over the last couple of years. Thanks for listening to my tale.